Unit 3, Part B. Hello guys, welcome back to my channel, and today's topic is antenatal care. In antenatal care, we will see preparation. What are the preparation that is undergone in the time of antenatal care? We provide antenatal counseling, antenatal exercise, antenatal diet, educate and prevent substance abuse. If the mother is addicted to smoking or drinking alcohol, or else even in the surrounding, she is not even allowed to stay in the surrounding of smoking and alcoholic surrounding, we will advise the mother to stay away from such surroundings. Education for childbirth. Regarding childbirth, we will provide the education, that is, what are the process that is undergone in the childbirth, what are the painful process, what are the methods, everything will be explained. Educate the husband and the family. We will advise the family and the husband to support the mother so that the anxiety level of the mother will be reduced. Preparation for healthy and safe delivery. Healthy, safe delivery is okay, but hygiene delivery is also important. Hospital should maintain the hygiene measures when it comes to the delivery process. Next, prevention from radiation. Yeah, this is given in the form of advice. Mother is advised to stay away from the radiating areas, that is, she is not allowed to undergo any x-rays and some other kind of radiation which causes harmful for the baby, so that the mother is advised to stay away from the radiations. These are the things that are seen in the preparation when it comes to antenatal care, and the first three is very important, that is counseling, exercise and diet. We will see these three in detail. First, antenatal counseling. In counseling, these four things are main. First, strengthening the prenatal bonding. Prenatal bonding is nothing but the bonding between the mother and the baby before birth. That is, the baby is in the womb. At that time, mother is connected to the baby. Mother is advised to talk to the baby and baby will respond for that. So by this method, the baby will be healthy. Overcome anticipatory fear of labor. Generally, every woman has a fear of labor. So we should speak to them. We should provide the courage to overcome the fear. Next, reduce stress that can negatively impact labor and birth. Stress can impact on the women directly on psychological thoughts. When the stress is increased, the woman's confidence level will be reduced. She will lose her hope. We should speak to her in a courageous way. We should provide that confidence that she can overcome this labor. So we need to reduce the stress. We should provide her a positive impact and reduce the negative thoughts in her. Find one's own individual style for coping with labor pain and choosing the birthing facilities. Not every woman will be okay with one method. There are several methods to reduce the pain, and every woman is special, so every woman will have a different method to overcome the pain. So we should find which method works for the women to reduce the pain and birth facilities. Lessons will be provided at the end of the chapter. Until then, stay tuned. Meet you in the next video.